In this video, I am going to explain you about basal ganglia and its pathways in a very simple manner. If you like this video, please share and subscribe. So let's start. So what is basal ganglia? Basal ganglia is a group of interconnected structures below the cortex in the brain. Basal ganglia includes a caudate nucleus, a lentiform nucleus, a subthalamic nucleus, and a substantia nigra. So here, these are lateral ventricles. This is third ventricle. Here is your caudate nucleus. Here is your lentiform nucleus. This is thalamus, and below the thalamus there will be subthalamic nucleus, and here will be your substantia nigra. So, basal ganglia. Definition. Basal ganglia is a group of interconnected structures below the cortex in the brain. Basal ganglia includes striatum, lentiform nucleus, subthalamic nucleus, substantia nigra. Striatum is caudate nucleus plus putamen, and lentiform nucleus is globus pallidus plus putamen. You should make a note here that both the striatum and lentiform nucleus here contains putamen. In addition to putamen, striatum also contains caudate nucleus. So the easy way to remember is in the spelling of striatum you get AT, and the spelling of caudate also you get AT. So this AT and this AT. So it will help you remember it. In addition to putamen, lentiform nucleus also contains globus pallidus. We all know globe is a shape. Shape can also be called as a form. So the lentiform and a globe. So it is having a globe form. So it will help you remember it better. Putamen has a motor function, whereas caudate nucleus have a cognitive function. What is cognitive function? Cognitive means thinking, reasoning, and remembering. Globus pallidus has two parts, globus pallidus externus and a globus pallidus internus. Substantia nigra also has two parts, substantia nigra pars compacta and substantia nigra pars reticulata. Function of basal ganglia is coordination of voluntary movements. So this is coronal section of brain. Coronal section is also called as frontal section. So what is coronal section? Coronal section is slicing the brain in such a way that the brain gets divided into anterior and posterior parts. So this is your caudate nucleus, this thalamus, putamen, globus pallidus, externus, internus, subthalamic nucleus, substantia nigra. One important thing is between thalamus and this putamen, globus pallidus, externus, globus pallidus, internus, there is internal capsule. So thalamus is divided from the lentiform nucleus. This is lentiform nucleus basically. So thalamus is divided from lentiform nucleus by internal capsule. Pathways of basal ganglia. There are two pathways, direct pathway, indirect pathway. The aim of direct pathway is to stimulate the movement, and the aim of the indirect pathway is to inhibit the movement. To understand these pathways better, let us take an example of exercise. So you plan to do exercise. So the direct pathway of basal ganglia gets stimulated. So now you're doing the exercise. Now while doing exercise you get tired, so you plan to stop doing exercise. So when you plan to stop doing the exercise, the indirect pathway of basal ganglia gets stimulated. So now you will stop doing exercise and you will be taking rest. So once again, the aim of direct pathway of basal ganglia is to stimulate voluntary movement, while the aim of indirect pathway of basal ganglia is to inhibit voluntary movements. So direct pathway. The excitatory neurons have neurotransmitter glutamate, whereas the inhibitory neurons have neurotransmitter GABA. You should remember this because this is very, very important. To understand this pathway better, you should remember is globus pallidus internus and substantia nigra pars reticulata always inhibits thalamus. Once again, globus pallidus internus and substantia nigra pars reticulata always inhibits thalamus. If you disinhibit this thalamus, then the thalamus will stimulate the motor cortex, hence perform voluntary functions or voluntary movements. So, when the body is at rest, globus pallidus internus and substantia nigra pars reticulata inhibits thalamus. So, the body is at rest. It's not performing any motor function. But now we are planning to do exercise. So, the motor cortex will stimulate striatum. When striatum gets stimulated, it inhibits globus pallidus internus and substantia nigra pars reticulata. When striatum inhibits globus pallidus internus and substantia nigra pars reticulata, the thalamus gets disinhibited. So we are disinhibiting the thalamus. So when the thalamus gets disinhibited, it stimulates motor cortex to perform voluntary motor functions. Hence, this is the direct pathway of basal ganglia. So now our body is doing exercise. Now we get tired and now we want our body to come to at rest. So our body stimulates indirect pathway of the basal ganglia. So initially you should remember point number 1 is globus pallidus externus is inhibiting subthalamic nucleus and the thalamus is stimulating motor cortex. So we are doing exercise. So we are still doing exercise. But now, to bring the body at rest, we should inhibit this thalamus. So it cannot stimulate motor cortex, so the exercise cannot be done. So now, to bring the body to rest, motor cortex stimulates striatum. Striatum in turn inhibits globus pallidus externus. So when striatum inhibits globus pallidus externus, this subthalamic nucleus gets disinhibited. When the subthalamic nucleus gets disinhibited, it stimulates globus pallidus internus and substantia nigra pars reticulata. And we already know that globus pallidus internus and substantia nigra pars reticulata inhibits thalamus. So when globus pallidus internus and substantia nigra pars reticulata inhibits thalamus, this stimulatory movement to the motor cortex is lost. Hence, the body comes to rest. So, when globus pallidus internus and substantia nigra pars reticulata inhibits thalamus, the body comes to rest because the thalamus can no longer stimulate motor cortex to perform exercise. So now let's discuss the role of substantia nigra pars compacta. Here you should remember that the aim or role of substantia nigra pars compacta is to always stimulate or increase voluntary movements. Substantia nigra pars compacta secretes dopamine and sends dopamine to D1 receptors on striatum. Hence, striatum gets stimulated and striatum stimulates direct pathway. And we all know that direct pathway stimulates voluntary movements. So, the direct pathway will increase voluntary movements. We also know that the indirect pathway inhibits voluntary movements. So, the substantia nigra sends dopamine to D2 receptors of striatum. Striatum will now inhibit indirect pathway. And when the indirect pathway gets inhibited, it can no longer inhibit voluntary movements. So, hence increases voluntary movements. Here you should note that this is substantia nigra pars compacta. It's compacta. Whereas here it was substantia nigra pars reticulata. So now let us discuss basal ganglia disease. Basal ganglia disease can basically be divided into two groups: hypokinetic hyperkinetic. Hypokinetic is reduced motor function, whereas hyperkinetic is uncontrollable motor functions. Example of hypokinetic is Parkinsonism, whereas examples for hyperkinetic disorders are Huntington's disease, dystonia, hemibalismus. Here you should also note that in Wilson's disease, excess copper buildup damages basal ganglia. This is very important. In Wilson's disease, excess copper buildup damages basal ganglia. Thank you.